.edu. I tell you what, we're going to do one short little pre-recorded message and then have a short break. There's some snacks out before we move to the last hour of the program. Okay? Yeah, I'm going up so late.
This is that special kind of therapy. www.mscglobal.com/consultation.
All right. So you were asking a lot about research, clinical trials, and information earlier. Those questions came up. And Larry Kellerman is going to talk a little bit later about some of the work, and we're going to talk about some of the charities in general. But the coalition's been awarding research grants, and one of them was awarded for the global MSA registry. And one of the doctors involved in this is Dr. Lucy Norcliffe-Kaufmann, who's out of New York. Okay, so she's local, and she's wonderful. She really would have liked to have been here today, but she couldn't. So she did do a little pre-recorded message just to inform you about it. There's more information online. If we have time, I know the day's wearing on, people are getting tired, we'll see. If we have time, we do, and I'll give you the handouts, but Larry will walk you through that process as well. So we're gonna let this play, it's a little 5-minute video, and then after that we can take a short break. And just to let you know, Dr. Kaufmann received her bachelor's degree in biomedical science, which is Ph.D. from the University of Durham. She received her Ph.D. from the Institute for Cardiovascular Research at the University of Leeds in 2005, her postdoctoral training at the Dysautonomia Center before joining the Faculty of Physiology and Neuroscience in 2010. She's the lead researcher in dysautonomia. She's responsible for planning, carrying out, and analyzing experiments. She's a member of the American Physiological Society and a current board member of the American Autonomic Society. She's a member of an international team that received funding from the coalition in establishing this global registry and study group. So it speaks to some of the questions that you were addressing earlier. So she's going to introduce the topic, and we'll revisit it a little bit later on. Okay, so I'm going to go ahead and let that play.
Hello and a very good afternoon to all of you. My name is Lucy Kaufmann and I'm a researcher at NYU's Dysautonomia Center, and I've been working with patients with MSA for the last 10 years. I'm really excited to be able to talk to you today about the Global International Patient Registry we have for patients with MSA and tell you a little bit about the natural history study that we've set up. And thank you very much for Cynthia for giving me this opportunity. I'm sorry I cannot be there in person, but I hope to meet you all in the near future. Our MSA Patient Registry and Natural History Study is an international collaborative effort, and we're partnering with clinical research groups throughout Europe, the United States, and in South America to build an international community that's focused exclusively on multiple system atrophy. We're building an international patient registry, and we have an ongoing natural history study. And the goal of this patient registry in particular is to help patients with MSA and facilitate future clinical research trials. So let me tell you first of all why we think we need a global MSA patient registry. MSA, as you well know, is a very rare disease, and patients are geographically spread throughout the world. And these factors make it very difficult to recruit a large number of patients to do good clinical research trials quickly. So because of the rarity of MSA, it's likely that no single institution and probably no single country has a sufficient number of patients to be able to do big clinical research trials. And that's something that we want to help do with the MSA Patient Registry. We want the registry to allow us to be able to contact patients with MSA and let them know about potential therapeutic trials that they can participate in on a worldwide scale. We've partnered with the MSA Coalition and NIH's Office of Rare Diseases to build the Global Rare Disease Registry and an international natural history study. As we like to say with our motto is united we stand and divided we fall. At NYU, we're part of the Autonomic Disorders Consortium, which was founded in 2009, and this consists of physicians, researchers, nurses, patients, and support groups dedicated to treating rare autonomic disorders like MSA in an international collaborative effort. And we've partnered with several sites across Europe, including Gregor Wenning in Innsbruck University in Austria, to bring together the international group that we've assembled. So the MSA patient registry is now up and running. And we have a total of 400, and I just checked the statistics today, we have 425 patients with MSA registered within the MSA patient registry. We have 100 patients with MSA that have been seen at clinical research sites that are participating in the natural history study. So we've been able to collect a lot of clinical data from patients with MSA. And we'd like to encourage you all today to sign up to the registry so that we can stay in contact. And we're very grateful to Larry, who, according to Cynthia, told me that he's going to walk everyone through the enrollment process today. So we look forward to expanding our numbers in the registry. I want to just let you all know finally that if you do have any questions about the natural history study or the patient registry, you can feel free to reach out to me, and I'll make sure that Cynthia has my contact information to distribute to all of you. And if any of you are willing to come to MSA and would like to be part of the natural history to come to NYU, and be part of the MSA natural history study, we will be delighted to have you. Thank you very much for all your support, and hopefully we can all come together to find ways to treat MSA. Thank you very much.